Buenas tardes, Latinos. Welcome to another episode of CTLN Opinion Plus. As you know, this is a space for the concerns of the Latino community, and one of those concerns is health. This week, our guest is the Commissioner of the Department of Public Health, Dr. Deidre Gifford. Thank you for joining us, Dr. Gifford, and I'm sorry if I mispronounced your name.
No problem. Thank you very much for having me.
Yeah, and it's Deidre Gifford, correct?
Deidre, that's right.
Yeah, I'm sorry. You were appointed by Governor Lamont as the commissioner in the middle of the pandemic. What has your biggest challenge been since taking the job?
Well, it is a challenge. Obviously, we're in the midst of a very serious pandemic, and we have done well in Connecticut for the most part, especially over the last few months. We had a very, very difficult spring with a high number of cases and sadly a large number of deaths as well. Over the summer, as you know, our cases went down, and more recently, like the rest of the country, we've started to see our cases increasing again in Connecticut. So it's been challenging to coordinate the testing that's required. We're in a much better position now with respect to the masks and gowns and gloves, the personal protective equipment or PPE that we need. We see a vaccine on the horizon, and there's some encouraging news about that. So I would say that the biggest challenge has just been coordinating all of the different parts and pieces that go into responding to such a complex pandemic.
This week, we received news that a potential vaccine is on the horizon, and that it's potentially, and the early signs say that it's 90% effective. States like California, Washington, and Oregon have said that they would review the safety of the vaccine prior to. Does Connecticut have something like that in place should a vaccine become available?
Well, as you know, Savannah, we have in the United States a very sophisticated and longstanding and well-respected process for approving not only vaccines, but other types of drugs and medical devices. And, more recently, there was some concern of potential political interference in those processes. I think in many ways that concern has subsided to some extent. I don't think we in Connecticut, nor does Governor Lamont, think that we need to, or necessarily that it would be a good idea to try to replicate or duplicate what the FDA and CDC are already doing. But the governor has appointed, as part of his vaccine advisory group, a subcommittee to advise on the science. And what they will do is they'll look at the process that the FDA and CDC and other federal agencies follow. They'll look at that and they'll say, that's our typical process. That's how these things usually go. They looked at the evidence. It was transparent. All of the things that are supposed to happen in the normal course, and provide reassurance to us and the people of Connecticut that really the process has gone as it should have.
That's really good to know, and very informative. Thank you. As you mentioned, the days are getting colder, and we have seen a spike in cases in some places around the country. Is there potential of a second lockdown in Connecticut?
Well, we want very much to not have another lockdown. And so last week, that the governor announced a number of steps that were aimed at preserving our ability to have our kids in school and preserving as much of our economic activity as possible, and preserving our capacity of our hospitals and our healthcare system to take care of not just COVID, but also all of the other important healthcare chronic diseases and acute things like heart attacks and strokes and broken bones. We want to preserve all of those things. So the governor did take some steps last week closing restaurants and other entertainment venues by 10 o'clock. We at the Department of Public Health put out an advisory recommending that everyone be home between 10 p.m. and 5 a.m. to limit the chances of contracting the infection, and also limiting gathering sizes to just 10 people. So we think that if everyone follows that those rules and that advice, that we have a chance of really slowing down the increase in cases that we're seeing. But it's going to take all of us working together, respecting one another, making sure we keep our masks on all the time when we're inside, and whenever you're around anybody outside. Limiting our family gatherings, unfortunately, to very, very small groups. And if it's somebody from outside your immediate household, keeping your masks on. So if we do all of those things, we have a good chance of slowing this down. But we do need to take those steps because we are seeing an increase in cases.
Right. And unfortunately, we have fortunately and unfortunately, we have the holidays coming up, and those are normally times of large gatherings. What's some advice that you can give to us? Because I know I really look forward to Thanksgiving every year. So what are some preventative measures that we can take that we can at least enjoy our family's company a little bit?
I think we all do, and I think this is going to be a difficult couple of months with Thanksgiving and other holidays coming up over November and December. Everyone's tired. We're tired of these steps that we've had to take. I think the isolation has been difficult for many people, and but as you point out, now is the time really to double down on these important steps that we know will work. And we just need to stay the course for a few more months until we get on the other side and there's a safe and effective vaccine. So the advice that we're giving at the Department of Public Health for the holidays is think about them differently this year. They're going to need to be different so that we can all respect and keep safe our family members and close friends. So the holidays should be smaller groups than 10 people in your home. We're thinking about, at my house, we're thinking about how we might be able to have some of our Thanksgiving outside if we're going to have people over, if the weather cooperates at all. Maybe have separate tables. If you're going to have somebody who doesn't live in your household over at your house, think about separate tables that are more than 6 feet apart, because you have to take your masks off to have dinner. And limit the consumption of alcohol, because that's when we start to see our judgment gets a little bit clouded and we let our guard down a little bit. So the same things we've been talking about since the beginning: wear your mask, keep your group size down. You have to be near somebody without a mask on. Make sure you're further than 6 feet apart. And then there are things that you can do to connect. We certainly encourage people to think about virtual holiday gatherings, think about phone and video conferencing, and ways to get together with family. It's so important that we stay connected for our mental health. And so do that, but try to do it in virtual ways rather than in person this year.
Maybe like a game that you can play across screens, or maybe even just ordering, similar meals, or preparing similar meals. Sounds like a good way to mitigate that.
It's a great idea. Yes.
Yeah. So not only are you a doctor, but you also are an expert, and you have a background in systems reform. Stepping away from COVID, but still talking about the pandemic. There are more than 20 cities across the country, including New London and Windsor, who have declared racism a public health crisis. And these cities have taken steps to, promise to take steps to address racism as a public health crisis. As a state, is there any plan to do so? And what can the state do to create more health equity in the long term?
Well, thank you for that question. It's such an important issue, and something that Governor Lamont and all of his commissioners are working hard on, even in the midst of COVID. It starts with, I would say, listening. So we've been working hard to make sure that we're listening and hearing from members of the community who have experienced racism and have experienced the disparate impacts of not only the COVID pandemic, but all kinds of different inequities in the healthcare system. So having open heart and open ears to listen and understand is certainly important. I'm a big proponent that we have to measure these things. And one of the problems in the area of Medicaid, which is the field that I have worked in primarily, is that we don't often have good data on race and ethnicity in the Medicaid program. And so sometimes it can be difficult to really take a deep dive look at things like maternal morbidity and mortality or different outcomes of chronic disease. So we have to do a better job of measuring and then reporting and sharing what we find. And that's how you learn, where the problems are and you can begin to tackle them.
When I saw that New London had declared racism a public health crisis, they cited a report by the Health Improvement Collaborative of Southern Connecticut, and they found that the coronavirus is affecting communities of color more than other communities. What is something that the Latino community and other communities of color can do to, I guess, be more preventative for this with this virus? What is something that the community can do?
Well, you're right that it's clear that the effects of systemic racism, that it does have effects on health. And it's something that we need to work on every single day in the healthcare system. In terms of what we can each do, obviously the advice is the same for all of us, which is to prevent COVID. The best thing to do is to limit your interactions with others when you can. I understand and appreciate that people who work in essential businesses, that's not as easy as saying it, right? If you are working in a place that requires you to be around other individuals, the important thing there is the mask. So we know that in the workplace, that having the mask on and everyone wearing the mask is a very effective way to prevent the spread of COVID. So in answer to your question, if I had one piece of advice, it is to have that mask on as the default. Whenever you leave the house, whenever someone is in your house that you don't live with, even if it's a friend or a family member, keep the mask on. The tricky thing about COVID is that many people who have a COVID infection don't have any symptoms. Maybe as many as half of the people who have COVID aren't experiencing any symptoms. So if I go over to visit somebody, a family member or a friend, even if I feel fine, I could in fact have a COVID infection and be spreading that to my family and friends if I don't wear the mask. So mask wearing is really a key part of the prevention.
Thank you very much, Dr. Gifford, for joining us today. I really appreciate it. This has been really informative and very useful for the upcoming holiday season. Thank you for taking the time again.
You're welcome. I'm so grateful that you had me on. Have a nice Thanksgiving, even though it's going to be smaller this year than usual.
You too.
Thank you.
That is all the time we have for today. Thank you again, Dr. Gifford, for speaking with us. Tune in next week for another episode. And remember to follow us on our social media handles on Twitter at CT Latino News and Instagram at CT_Latino News. I'm Savani Campos with CTLN Opinion Plus. Thank you so much for joining us. See you next time.